Encounter is brought to you by the Broome County Council of Churches, where we connect compassion with needs as we inspire growth with dignity. You'll find us in special places throughout the community. For those who remain hungry, we provide meals. For those who are challenged, we build wheelchair ramps. We comfort those who are ill, minister to those who are confined, and we remain an advocate for change and understanding on behalf of every element of our community. Connect and inspire. Encounter the Broome County Council of Churches.
Good morning, friends, and welcome to Encounter with Broome County Council of Churches. My name is Talia Moore, and I'm your host. Today, we're talking with Angelina Blasich from the Golden Days Adult Day Healthcare Center, and she is the LMS director there. And so we're going to ask you just a little bit about yourself, and then also just give us a little bit more about Golden Days.
Sure. I am an LMSW. I'm a mental health professional. I've mostly done mental health work and worked with incarcerated youth throughout my life. When I started to work for my master's, I was offered the opportunity to work with elders and to work in healthcare for the first time, and found it to be a really profound experience. I didn't expect to be running an adult day healthcare program. I didn't even know what an adult day healthcare program was.
Right.
I rather stumbled into it and found the most creative, exciting, dynamic environment I could find as a social worker, where I'm able to engage in mental health work. I'm able to engage in uplifting people from a spiritual place, kind of that mind, body, spirit, full health.
Mm-hmm. Mm-hmm.
So yeah, it's exciting.
Wow. So what really inspired you to start working with Golden Days?
I had gone to Susquehanna Nursing and Rehabilitation for employment, and they offered me this position because they were looking for someone who was going to think out of the box. And adult day healthcare works differently than any other medical program.
Mm-hmm.
So it really requires kind of a different way of approaching things. We have about a third of our population have developmental disabilities.
Okay.
About a third have some degree of cognitive impairment, dementia or traumatic brain injury, mental health concerns.
Mm-hmm.
And about a third have some degree of physical disability.
Mm-hmm.
And then there are folks that kind of have all of those, right? So what this afforded us was the opportunity to afforded me was the opportunity to engage with all of these populations throughout each day. And it's really stretched my abilities. It's really exciting.
Oh my goodness. I know that there are a lot of different activities that people get involved with when they go to the adult day healthcare programs. What are some type of activities do your patrons get involved with?
Well, we serve breakfast, lunch, and snack every day. So first off, people are getting solid nutrition, nutritional support. We also provide a full range of medical services where folks are able to get the medical needs that they have met and stay in home in the community instead of having to move into an institutional space.
Mm-hmm.
So for example, someone may need to have their insulin taken care of in the morning before they have breakfast.
Mm-hmm.
We'll check their sugar, provide the insulin coverage, and then give them breakfast, a nice, warm, healthy breakfast. We have exercise program every morning, which is really a lot of fun. I actually lost some weight. It was lovely. And then after exercise, we usually engage in some kind of craft activity, something that is going to stimulate us aesthetically so that we can appreciate beauty and actually physically create something.
Mm-hmm.
After that, we have a full nutritional lunch. People have options of at least 2 entrees for lunch. And then if they don't like either of those, there are still other options that they can take.
Right.
And then after lunch again, we'll have games. We have and other kinds of arts and crafts activities, entertainers that come in from the community.
Okay.
We work with different, the Memory Maker program, with other kinds of art and humanities programs to come in and share educational opportunities, as well as stimulating art activities, opportunities for people to engage with each other.
Wow.
A lot of times illness leads to isolation. It makes us feel like we don't belong out in the world anymore. We're embarrassed to go outside with our walker or with our oxygen tank. We're embarrassed to take a long time. We feel like we're burdening people.
Wow.
And in this space, at Golden Days, there's no burden to anybody. Everyone is there with some kind of functional need. Everyone has something that they need a little bit of extra time for or a little bit of extra help for. So it kind of normalizes the experience of living with illness and living out in the community with illness, not tucked away somewhere.
Okay.
We go out into the community at least twice a week, taking our folks wherever they want to go. Our registrant council decides once a month what our trips are going to be. So we'll go to Big Lots and we'll go to, I don't want to name drop anything. We'll go to various and sundry coffee shops and ice cream places and, okay, I'll name drop the cider mill because we just love their donuts.
Their donuts are amazing.
We take multiple trips to the cider mill. Yesterday we went to Iron Kettle,
Okay.
right? We like to take seasonal trips, going to the places that people would go if they had the mobility and the access. The purpose of our program is to provide access to the community, to provide access to engagement with other individuals, and to provide access to healthcare at the same time.
That is amazing. So even just breaking down, what is an adult day healthcare program, and how does Golden Days differ from traditional adult day programs?
Adult day healthcare is really a character unto itself.
Okay.
Adult day healthcare kind of bridges the gap between social programs like senior centers or social day programs,
Okay.
like yesteryears, right? And then and institutionalized spaces like assisted livings and nursing homes and hospitals. We provide that space for socialization, for health care and monitoring, for skilled nursing service,
Okay.
and a space where we can continue to keep an eye on the progression of someone's illness. We work in conjunction with each individual's primary care physician. That primary care physician is the person who is directing that patient's care. For us, they're not a patient, they're our member. The members of Golden Days have physical and mental health needs, so we're always going to work with their provider to make sure that they're getting the kind of care that they need.
Right.
We also make sure that we talk to all the providers. Sometimes our members may have 3 or 4 different providers that are each prescribing different things. And maybe they're not communicating as well as they might wish they were.
Right.
We can provide that space in the middle where we're kind of warehousing all of this information, making sure that the primary care physician has that information as well. We have an independent pharmacist that comes in every 6 months and takes a look at everybody's chart, takes a look at the medications they're taking, and if anything is counterindicated.
Wow.
Is this really the best idea for this person? We don't make those changes. We contact the primary care physician and say, hey, are you aware that this individual is taking this medication and this medication? And they might say, yep, I am, and I want to keep doing just that, in which case we'll leave it alone. Or they may say, oh no, I wasn't aware, please, yes, let's make that change. So we're able to also act as advocates in that regard. For some folks, they might be having problems with housing, or maybe they're not aware of other kinds of case management resources in the area.
Okay.
Maybe they're not aware of food resources. We also help to provide, as the social worker there, we also help to provide links to all of those services within town. We have a relationship with Adult Protective and with DSS. We have a relationship with Achieve and Family and Children's. We have a relationship with all of the various OPWDD programs. They're wonderful, with Greater Binghamton Health Center, with Lourdes and Wilson in general. We have these wonderful relationships with UHS and Lourdes, where folks are reaching out to us and saying, We really want our patients to stay in the community, but we want them to do so safely. Their family is struggling with making that happen. Can you help us bridge that gap?
I mean, there's just so many things that you guys offer. It's like, can I get involved? No.
You really can. You know, we always look for people to get involved and offer what it is that they have to offer. We have artists that come in and teach art classes for us, and that adjust these art classes. You know, we can serve folks 21 to, you know, ancient. I don't think I have anybody ancient. We've got 90s, but I haven't quite so, you know, that's quite a large span. So we have a large range of cognition and of intellect. We have a large range of physical ability. So we're really looking for people to come and bring dynamic adult programming to those individuals that are able to adjust that programming. So yeah, we're looking for artists. We're looking for musicians. You know, if someone wants to teach a chair tap dancing class, I don't know if they exist, but I'm totally interested.
It probably does exist somewhere out there.
Yeah, anything that we can do to provide a space where our folks are engaged.
Right.
Again, when we start to experience physical illness, it starts to impact us emotionally, and it impacts our mental health. When we experience depression, when we experience anxiety, we start to kind of separate ourselves from the things that bring us joy. We don't even necessarily know how to experience joy sometimes. And we forget that we're able to be stimulated. We forget that we're able to create things, that we have the capacity to participate in life.
Right.
And the more we withdraw, the more isolated we become, and the sicker we become. Golden Days serves to keep people engaged, to encourage people to come out of their shell and to come out of that fear space, you know, to leave their house every Monday, Tuesday, and Thursday, and you know, have lunch with people, to talk, to laugh, to cry.
If need be.
Yeah.
Wow. And just speaking about that, just the human touch and experience in your time in being with Golden Days, on a general level, what success have you seen with the patrons that have come through your program?
I definitely see an increase in overall health.
Okay.
There are actually some folks that they came to us and over a couple years have moved on to a regular senior center because they just don't require that degree of health care anymore, which is awesome. It's a wonderful problem to have.
Right.
We have individuals who, you know, when they first came in, really didn't talk to people, really kind of avoided eye contact, maybe sat at a table by themselves. Maybe they only talked to staff, or they would only answer direct questions. After 3 to 6 months, you start to see people coming in and their hair's combed every morning, right? They're dressing nicer and their shirt is tucked in. And they'll come in and say good morning to people by name. Wow. And these don't seem like big things. These seem like really little things. But for someone who hasn't left the house in 3 years and hasn't gotten out of their pajamas and hasn't interacted with someone who wasn't coming to help provide for their health at home, it's a big deal, right? I'm watching people start to exercise. So you watch people lose weight. You watch people start to pay attention to their nutrition. We've had individuals who didn't have access to proper hygiene at home, whether it was because of, you know, poor plumbing or because of their illness. They didn't have an ability to get in and out of the tub safely anymore. Elderly loved ones taking care of, you know, middle-aged folks with developmental disability at home who are still trying to provide for health or for hygiene at home can be really dangerous.
Right.
Sometimes the difference between someone living safely in the community and someone being in a more institutionalized space is just the ability to stay clean, right? You know, our folks walk back and forth from, if they can, from program area to program area. People that live in maybe a small apartment or one-bedroom apartment, and they, you know, maybe walk to the kitchen and to the living room with their walker, maybe taking 5 or 6 steps each time they go back and forth. we have a physically larger space and we encourage more movement. So we have folks that are actually able to get up and move around on a flat surface with people there to support them if there is any kind of fall. And we have all the adapted exercises to keep people physically going. The more you move, the less physical pain you have. The less pain you have, the better you feel about life, and the more you're willing to engage. It's a delightful cycle. Just as the isolation is a vicious one,
Right.
the golden days cycle of socialization is really an exciting one.
Wow. So we are again speaking with Angelina Blasich. I always get those things wrong. And